Getting ready for a frozen embryo transfer? Welcome to the world of perfectly timed meds. Unlike a natural pregnancy, surrogacy needs a little extra prep. Think of it as setting the perfect stage for embryo implantation. Every fertility clinic has its own style of tracking, dosages, administrative methods, and schedules. But no matter the format, one thing's for sure, following the calendar with precision is essential for optimizing implantation success rates. Let's go over some best practices for managing your FET calendar. Step 1. Watch and learn. Familiarize yourself with proper injection techniques by watching videos and tutorials until you feel confident. Step 2. Set those reminders. Use alarms, apps, or notes to adhere to the prescribed schedule. Step 3. When in doubt, call your case manager. They are there to help you every step of the way. Step 4. Double check your dosage. Some meds change over time or have gradual dosage adjustments. Always review a prescription before you inject or pop a pill. Step 5. Store meds correctly. Should it be in the fridge or at room temp? Check storage instructions so your meds stay effective. Step 6. Keep your stash stocked. Make sure you keep an adequate supply of medications, syringes, and necessary equipment to prevent disruptions. Also order refills early to avoid last-minute stress. Step 7. Dispose of needles safely. If you have used needles, pop them into an approved sharps container. Many pharmacies and health facilities will also take them for free. Step 8. No meds left behind. FET meds are pricey, so measure carefully and avoid waste. Now let's briefly cover the different types of medications, timing, and administration. First up, oral meds. These help balance hormones. Just make sure you take them at the same time daily for max effectiveness. Next up, injectable meds. These might seem intimidating, but don't worry, we've got your back. Stick to the schedule and you'll be a pro in no time. Here are some hacks for a smooth experience. Stick to a consistent schedule to keep hormones stable. Switch injection sites to avoid soreness. Warm up progesterone oil before injecting. This will help with absorption. Use ice or heat packs to ease any post-shot discomfort. Lastly, some FET protocols include vaginal suppositories for extra progesterone support. Here are some tips for how to use them. Follow the prescribed dosage and frequency. Stay reclined for a few minutes after inserting to help absorption. And last but not least, expect a little discharge. A penny liner might be your new best friend. Now that we've discussed the potential different types of medications, let's talk about the optimal timing for using them. Check out our chart below for medications commonly administered. Taking your meds in the morning helps doctors track hormone levels and make adjustments if needed, while nighttime doses keep hormone levels steady while you rest. Your FET calendar isn't just about meds. It's packed with important check-ins to track progress and keep everything on course. Here are some key monitoring stages. You can expect a baseline scan. This kicks things off by confirming your body is ready for meds. Lining check. Measures your uterine lining thickness to make sure it's just right for the transfer. Pre-transfer hormone check. Ensures your estrogen and progesterone levels are in the sweet spot. Pregnancy confirmation. This is the big moment and done by 10 to 12 days post-transfer to check for implantation success. Every scan and test gets you one step closer. Trust the process. Remember, if you have questions or uncertainties, your case manager and clinic are there for support. So stick to your calendar, stay on top of your meds, and let's set you up for success. You've got this.